We turn now to one more terrible side effect of the recession, child abuse.
There's a new study out linking the bad economy to a rising number of cases of shaken baby syndrome. Dan Casuto talked to an emergency room doctor here locally today.
Well, Greg and Dana, the only encouraging news here is that hospitals here in Madison are not seeing an increase, but other hospitals around the country are.
Whether out of frustration or sheer anger, this demonstration shows how traumatic it can be to shake a baby. One doctor described it as whiplash between a baby's brain and skull. New research suggests more adults are doing this to their babies, possibly because of the recession and all the stresses that come along with it.
Typically, it's because there's kind of a change where the adult expects the baby to meet their needs, or frustration with the baby and other social stressors going on.
We checked in with emergency room doctors at St. Mary's in Madison. They are not seeing an increase, but they know other hospitals are. The study tracked cases of shaken baby syndrome at 4 hospitals starting back in 2004. In the 3 years before the recession, the hospitals reported 4.8 cases a month. In the 2 years after, up to 9.3 cases. The study's author thinks the bad economy could be a strong link. That's a big increase and a lot of new babies who are suffering.
Some of the signs and symptoms, they can be very subtle, such as failure for the baby to thrive, poor feeding, lethargy, fussiness, all the way up to seizures and non-responsiveness.
And here's one more piece of information from the study. 90% of the babies came from families on Medicaid. And because most adults on Medicaid happen to also be in a situation where they don't have a job, the researchers could not say for sure whether job loss actually was something that contributed. They simply don't know that.
All right, Dan. And about 15% of the babies in that study died after they were taken to the emergency room.